Hi there and welcome to this video. Dr. Surinder Sandhu here, Doctor of Chiropractic from Bedford Chiropractic Clinic, the most experienced chiropractor in Bedford with over 25 years experience. Over those 25 years, I've treated well over 30,000 patients and actually completed well over 130,000 adjustments on my wonderful patients. So today, welcome to the video. I'm going to talk to you about hip pain. It might be something that you're experiencing right now. It might be something that you have had in the past, or you may know somebody who's experiencing hip pain. I'm going to explain to you the reasons for hip pain, why you potentially have it, and then what I can do for you. Okay, so hip pain. Hip pain is related to the hip joint here. Now, please understand that hip pain, although you might be feeling it sort of actually in the hip or maybe even sort of in the groin, around here in the front of the hip, you might be feeling it at the back, you might be feeling it around here, you may even be feeling it sort of down sort of here in the thigh down here at all as well. Now, understand that there are various reasons why you may have this hip pain. It could actually be related to the hip joint itself. It might be that you've damaged the hip joint itself. It might be that it's arthritic. And unfortunately, over the years, I have treated multiple patients who have had serious hip arthritis, which they were unaware of until they started feeling the pain. Because your body is incredibly good at holding on to sort of wear and tear, holding on to arthritis until there's a straw that breaks the camel's back, and that straw can be a simple thing like bending over, picking something up, maybe tripping over sort of a loose pavement slab or kicking something. It may even be just stepping down from a high step. So any of these factors may instigate the pain, but please understand the problem has possibly been there for a very long time, and you, like most of us, have just ignored it and carried on going. So the first thing that we need to do is to work out why have you got the hip pain. So as I mentioned to you, it could just be that it is a muscle spasm. It could be the psoas muscle, this big hip flexor here, which attaches into the hip joint. It could be that you've just got tension in this muscle in here. And the majority of people struggle with this muscle because we sit too much. And that hip muscle attaches all the way to the trochanter right here, and that could be causing your hip pain. It could be one of the glute muscles, either the piriformis or the glute medius, which could be tight, which could be aggravating and restricting the movement in the hip joint. It could be that. It could be that your SI joint is stiff and affected. That could be giving you sort of that hip pain. It could be that it's one of the big muscles up in here, which is giving you referred pain into your hip joint. So any of those factors. It could even be, and this is important, right? It could even be your foot that's causing the hip pain, because this is something that can get missed. Right, but not here, not with me, because after 25 years, right, I have found that majority of knee and hip problems actually come from the foot, because the foot controls what happens to the ankle, what happens then into the knee, right, and then of course what happens into the hip. So your hip problem may be caused by your foot. But the beautiful thing about coming here and seeing me is that I'm going to look at all of that. Okay, I'm not just going to look at your hip joint, because we need to find out why. Why have you got the hip pain? And that is the big difference between myself and just taking a painkiller, going to your GP or waiting, because none of those are going to actually resolve the underlying issue of why you may have it. And as I said, it could be a foot problem. It could be that you are pronating. Watch one of my other videos where I talk about pronation and I talk about sort of how the foot sort of affects everything else. But hip joint is really important, right? It's important for movement, it's important for stability and for standing, walking, all of that. And if you're in pain, all right, it is not nice. So the first thing we're going to do is find out, why have you got the hip pain? What is it that's causing it? Once we've worked out the cause of it, what we'll then do is we'll then do some adjustment and do some treatment. And if you're worried about forceful adjustments, if you're in pain at the moment and you're thinking, my gosh, he's going to hurt me, Okay, I have to tell you that I am not one of those chiropractors who does all those hard, forceful drops and adjustments on you. Okay, I will be doing some very gentle treatment on you using something called an activator. I may do a little bit of stretching with you using some resisted isometric muscle sort of treatments to try and get the joint to work. I may even do some very gentle drops on you as well to get your joints mobilized, because we need to get the SI joint moving, we need to make sure the hip joint's moving properly, and of course we need to check the rest of the kinematic chain. It could actually be coming from your back as well. Certainly what I found is that sort of an L2-3 problem, an L4 problem can definitely create sort of a stiffness and ache in your hip joint as well. So you're going to get all of that examined as well. We'll also be looking at your QL as well, the muscles in your rectus spinae, to see whether they're aggravating or causing it. So you're going to get a complete health check is what I'm trying to say to you, because we need to find out why you've got that pain. And then we'll resolve it. And we'll resolve it through treatment and also through corrective exercises. And I'm going to talk to you about, firstly, ergonomic advice. We're going to talk about are you standing, how are you sitting. I'm going to talk to you about sort of how you can improve that. And then, of course, I'm going to refer you to my website and give you exercises, personalized exercises, specifically to help you with your groin pain as well. And then as we go through the treatment process, we'll talk about sort of stabilizing and strengthening exercise as well. And you're going to get all of that when you come and see me. So if you have hip pain, if you're struggling with your hip pain, please don't. Give us a call today. Okay, my number is below, and I look forward to helping you. Dr. Sandhu, the most experienced chiropractor in Bedfordshire with over 25 years experience, and I know I can help you. You just need to give us a call today. We'll get you in today. If not, we'll get you in as soon as possible, because I am here to help you and serve you. God bless you, and I look forward to seeing you and helping you. See you soon. Give us a call today.